I'm a professor of nursing at the University of Pennsylvania School of Nursing, and I'm the co-director of the Healthy Aging Core for Penn AI Tech. I apologize that I don't have my camera working today as I tried to get into this meeting at 11:30, and all in preparation. Recognized my camera's not working. IT wasn't able to fix it in time. And so here we are with just a voice in the air. But it's my pleasure to introduce welcome you to our Penn AI Tech webinar series. And Penn AI Tech stands for the Penn Artificial Intelligence and Technology Collaboratory for Healthy Aging. And this is an initiative at University of Pennsylvania and several other places that is funded by the National Institute on Aging. And Penn AI Tech promotes the design of innovative technology and artificial intelligence methods and software to support older adults and those with Alzheimer's disease and related dementias in their home care environment. So it's our pleasure to bring this webinar series to you to showcase a lot of the amazing work that's being done across the nation. It's my pleasure today to introduce our speaker, Dr. Priya Nambisan. Dr. Nambisan has an undergraduate degree in public health, a master's degree in nutrition, a PhD in communication and technology, and a postdoc in health informatics. And she blends all of that together in a program of research that's been about providing social, emotional, and informational support to health consumers and patients using digital platforms and online communities. She's presently an associate professor at the Zilber College of Public Health at the University of Wisconsin in Madison. And congratulations to Dr. Nambisan, who just this year was selected as a 2024 Fulbright Scholar, where she plans to expand her work to India during that fellowship. So today's talk is entitled Designing a Digital Platform for the Aging Population with Multiple Chronic Conditions. I'd like to remind all of you that the talk is being recorded, and you may use the Q&A area in Zoom to post your questions throughout the talk. But we're going to wait until the end of the talk to go through them, and I'll moderate the question-answer session. So without further ado, I'd like to welcome Dr. Nambisan to go ahead and begin her talk. Thank you.
Thank you, Kathy, for a nice introduction. I'm at the University of Wisconsin-Milwaukee. I'm at the College of Public Health, Joseph J. Zilber College of Public Health. I am also director of Aging Research and Digital Technologies Lab, and also Social Media and Health Research Training Lab. Okay, so my topic is on designing a digital platform for those with multiple chronic conditions. Most of the other platforms and apps are for one or two chronic conditions or several symptoms, and these are all very, very valuable. But my focus has been on those suffering from multiple chronic conditions. And as per AHRQ, the definition is co-occurring two or more physical and mental health conditions. And MCC often also is referred, called multi-morbidity. So the number of people with multiple chronic conditions are increasing across the world. And now we are also finding that young people, including children, are being diagnosed with multiple chronic conditions. For older adults specifically, more than 80% have multiple chronic conditions. It's basically among older adults, and they are dealing with all this along with other degenerative, age-related degenerative and functional disabilities. So what is MCC and what are the implications of when patients have multiple chronic conditions? MCC often leads to multiple medications, complex treatment regimens, and a lot of other complications. So, chronic conditions, most people know about it as heart disease, diabetes, cancer, COPD, and other arthritis and such major conditions. But most of these conditions will also include a lot of symptoms. So the symptoms can range from those that are from the disease itself, as well as the side effects of treatment and medications. So it is very, very complex when someone has more than 2 chronic conditions. So MCC also increases the risk for other chronic conditions. So once you get diagnosed with diabetes and heart disease, soon you're going to be diagnosed with a lot of other conditions as well. And now we have studies showing that MCC also increases risk for dementia, Alzheimer's in later life. So it is complicated, and the more preventive care that we can do, the better. MCC also increases burden on caregivers because they have to remember the medications, they have to follow guidelines for treatment, and it becomes more and more complicated as older adults have more symptoms and more conditions to deal with. MCC increases hospital utilization. We have so many studies showing that the more complex health conditions, or the more cluster of health conditions that people have, the more they get admitted to hospitals. They use emergency care, and that's significantly increasing hospital utilization. MCC definitely reduces quality of life for the older adult. So many things to manage, so many medications, so many side effects, and that reduces quality of life. And with most chronic conditions, depression, anxiety, etc., coexist. So when it is multiple chronic conditions, these are much higher and more severe. MCC also, for some of our recent work related to this, we are finding that MCC and social isolation and loneliness are very, very highly associated. Now, there are studies that are showing that MCC leads to social isolation and loneliness, and there are studies showing that social isolation and loneliness might be leading to more chronic conditions. So, but it is coexisting. And MCC can increase the risk of suicide among elderly, and that is one of the studies we are currently planning, because we really don't know what kind of clusters, what kind of pathways from MCC to suicidality, because there are studies showing certain chronic conditions increase suicidality, but there is no consensus between researchers on which chronic conditions or which mix of chronic conditions lead to suicidality. MCC, the last 2 points are the reason why I started this whole platform. Because MCC makes it very, very challenging for people to communicate with their physicians, especially for older adults, because they can't remember most of these symptoms that they are having. They don't understand many things. They don't understand which one is from the treatment and which one is from the medication and which one is the one that they need to take care of. And it is very, very complicated. And due to memory issues and other things, they find it difficult to communicate coherently with their physicians. And most importantly, it is very, very complex to track, monitor, and manage symptoms when you have so many different ones. And most of the time, these chronic conditions, they have flare-ups, some gets worse, some gets better, and you have to keep track of many of these and communicate it well to your physician so that they can actually help you with it. Okay. So, most apps and platforms for chronic conditions are mostly single disease focused, and there are very, very good such apps. But for older adults, using these apps means, they have to download multiple different apps so that they can track all their conditions. There is no single platform so far. As far as we have done, we did a review of all the apps available on iOS and Google, and also looked through online to see if there are anything that includes all kinds of symptoms and health conditions. I have Apple Watch, and they have something, but it only allows you to say whether your symptom is mild, moderate, or severe. It doesn't collect detailed information regarding each of those symptoms. And it's not just physical health symptoms. You have to also include mental health issues, social, behavioral issues, medications. All that needs to be included. And on top of that, you have to get the users to actually use it. And there is no systematic methods so far in literature on how to build such a comprehensive platform or app for older adults. And there is always the issue of generalists versus specialists. Even in app development, we seem to have that. It's mostly in the medical care, but now even in apps, we have that. So, specializing and narrowing to one or two chronic disease actually makes the app more better. And so there are people who focus on just that. Okay. So I will first, now about the development of the comprehensive digital platform. I will try to explain how, what was the conceptual idea, and then I will actually show you the platform. But this was the initial conceptual idea. I looked through literature to find out what is actually important for older adults in terms of building such a comprehensive digital self-care system. And I found that prevention is important. Holistic, integrative, and comprehensive approach is very, very important for older adults with MCC. And they need community and home-based support for care. And most older adults don't like going to the hospital or to the healthcare organizations. So home-based and community-based care would be the best. Education and training should be incorporated with it so they understand things better rather than just do things because one doctor said this, one nurse said this, and they are often very confused. Social and emotional support should be part of it. Privacy and security is very, very important because most of the elderly people who don't use technology, they're scared about the privacy and security settings. And last but not least, even if they're older adults, they should have positive experiences, fun experiences. Many older adults I've met said, they love playing online games. And so it has to have fun experience along with it. So then I looked at what are some of the technological elements we can incorporate in a technology-based platform. The components would be data analytics and management. We can actually analyze data, present it to them in a way they can understand, improve communication, that is communication between them and their care provider, as well as the informal caregiver at home. And we can also bring resources to them based on the data that they're inputting. So that would lead to better learning, social and emotional support, and more care integration. So this was my conceptual idea. And then, okay, now I will see if I can show you the platform. So I have to stop share and go to the website. So this is a web platform, and it's very responsive to all devices. So you can use in smart phone or tablets or anything that they want. So what this on the outside information, you can actually get it from here. We have community partners, research partners. Our team includes some wonderful graduate student interns, and all kinds of information you can actually find here as well. So once you log in, it is very, very private and secure system. No one has access to it. And we do take detailed information separately before we allow people to access this. What it has is, all kinds of different trackers for almost so many different health conditions. Specifically, we have things like urinary incontinence, bowel incontinence, and things like that you don't find in any other apps. We also have gastrointestinal issues, which is very common among older adults, but it is never captured, and it is also not communicated well to their physicians. We have emotional data trackers. And each of these trackers is different. It's not like mild, moderate, severe. I'll show you a few. For example, a sleep tracker is this. And instead of wearables and other things, we ask questions like whether the sleep was refreshing or whether they had difficulty falling asleep, which actually captures better your sleep quality. You can also see, for example, constipation, and the questions we ask are very much like the questions a clinician would ask a patient, when did it start? What was the frequency? How many times did you get it? What was the difficulty? So all these are, just drop down menus. It will take them only a few seconds to finish it. And all the trackers also have reflection space where we have provided prompts so that they can enter any kind of comments regarding that. We also have a lot of other features, and this, anything that they enter, they can actually see in a table form, so they can actually go back and evaluate, Fridays are the time that I'm not sleeping well, what is going on. And we also have charts. You can see it in chart form, as well as you can, use the play with my data feature to actually compare two ailments. So this is, very extensive. We have quick notes. You can enter questions for my doc, and these are more and more features are added when people who are using it tell me that they want this or that, and I keep adding those. We also have extensive social health surveys. I believe that social health needs to be measured comprehensively, not just one social support survey or social isolation survey. You have to collect data on many of the different variables of social health. And this is very, very highly customized. You're seeing all the trackers because I have picked all the health issues. So when people register, they pick one or two and they'll see only those that are relevant for them. The trackers, the general trackers here, everyone will see because these are preventive ones, but the rest of them, it is based on what kind of health conditions that they need to track. We also have, detailed medication collection forms, and I'm adding more to that. You can also set goals, update self-care goals here. Then, another important feature that we have is you can actually give access to a caregiver. So if if the person is a frail elderly, you can actually get a caregiver to add in all this information, or just see the tables and charts if the caregiver is out of state and they would just want to see what is going on with their parent, they can do that. We also have several healing stuff, music, learning dance, games, yoga, exercise, and detailed, very extensive health forums for people to interact with one another. Okay, so now I'll go back to my presentation, which is a two-step process here. I don't know why. Let's see. You're going to see my full screen. Let's see.
You go to the slide and then go from play from current slide. Looks like slide 6.
Okay, yes. Play from current slide. Can you see my full screen now?
Now we don't see anything. It's not.
Okay, let me see now.
There you go.
Yes, yes. Okay, so that was the platform, and we did a very extensive needs analysis. I talked with older adults with chronic conditions as well as their caregivers and built the system. And then the prototype was taken back to older adults in the senior centers where they looked through it. We also took it to geriatric clinicians to see, what other things that they would like to add. And then we tested it for usability and feasibility with older adults, although that time coincided with COVID-19. And so I had to recruit from online at that time. But we did a good needs analysis and it was published. We have been constantly adding and changing things. For example, we interviewed people, different specialists from different organizations to see if, for people who have diabetes, whether we have all the features that they need to keep track of health issues. And currently we have a couple of studies. One is pain and social support. So this platform allows daily data collection, and our pilot study made people use the system for 4 weeks daily. So it is possible to collect data on a daily basis from older adults. And the possibility for studies using this platform is endless. Right now, we have a study that we are looking at whether when people have higher social support using our social support surveys, does it, change their feelings of pain? If their social support is high, does the pain come down? And we also have another ongoing study that we are testing it with people with the dementia, early stage dementia, mild cognitive impairment, and also multiple chronic conditions. So we are recruiting both early stage dementia as well as people who are providing care, caregivers. In that case, we are not going with early stage, but at any stage, and there are some caregivers currently using it to keep track of their health issues of people who have dementia and Alzheimer's, and also especially if they have multiple chronic conditions. So I'm also working on adapting it for CDSS, the CDSS for older adults in India as well. So what are some of the outcomes we can evaluate if people use it? Can we say, you make them use this and see if their sense making of complex health conditions improved and health literacy improved? That's a planned study. Can we use this system to train patients to improve communication with their physicians? When I did the pilot study, a lot of elderly said, oh, I can take this to my physician and show it in a graph what is going on. So that is good. So many elderly people I have talked to want to actually have something with them to show their physicians during their communication so that it's all coherent. This might improve patient engagement because they see the symptoms going up and down, and so they might be more engaging with their care. Patient empowerment and self-advocacy, that is an important area where sometimes when people complain about certain symptoms, they don't, the healthcare system may not listen to all of it, or they may not capture all of this. So this will actually help them say that, no, I had this, look at this, I have tracked this, and I know that I'm not sleeping on Fridays, or I'm not sleeping when I get constipation. So these kind of things, patients will be able to emphasize and stress and get it through to their clinicians. It can act as a memory aid for older adults, improve behavioral outcomes. So that is another thing that most apps have as a positive outcome. And this might also, since in this we can actually compare whether, a change in diet or exercise actually improved blood pressure, so that could actually make them feel that they can actually change the their exercise to make sure that the BP comes down. And I have actually done a study long time back among those with intellectual disabilities, and they had a BP monitor that was given to them, and they actually came to my focus group and said, they actually found that exercising actually reduced their blood pressure, and they were very motivated to go for a walk because it was actually reducing their blood pressure. Better self-health management, that's one of the outcomes that was early on that I was I'm trying to evaluate, and that people actually understand what is going on, and they take care of themselves, do some self-care activities. Personal health information management, and this is also an electronic diary for patients and caregivers to keep track of things. Provider side outcomes, if patients did do all this, they get a better view of what is going on with the patient. There could be better compliance with treatment, adherence to treatment and preventive care guidelines is another outcome. Better patient-provider communication. So I'm always looking at this one, and most of the questionnaires look at the provider side communication. So patients are surveyed only about their perception regarding their provider's communication. But I'm from the field of communication, and it is two-way. So if patients don't engage and ask questions, a provider cannot communicate effectively. So it's a two-way thing. It's not one way. So if the patient asks a lot of questions and does a lot of the homework, then the provider will find it easy to communicate. This will also, if communication improves, the relationship also improves, and they are on the same page when they are talking with each other. Some of the ongoing challenges, I'm applying for a lot of grants, and the questions are about, can older adults use technology? Yes, they can. And we have a lot of recent studies showing that older adults can use technology, and they do use it regularly. I think the penetration rate of smartphones among elderly is around 91% right now. So yes, they can use technology. Questioning the feasibility, can older adults use the system daily? Would they want to use it? But we have so many studies now in diary studies and in EMA studies. EMA is ecological momentary assessment, which is frequent sending of questionnaires that they keep filling out things. So this is not as difficult as many of the EMA studies out there. But diary studies, closely resembles. Unlike diary studies, this is more structured, and people get to fill out a few things and get out of it. So yes, there is plenty of evidence, and our own study showed that, after our pilot study, most people did not get away immediately. They want to continue using it, and some used it for around a year before they stopped using it. So future plans, and it's a work in progress. I keep adding new trackers, new features are being added regularly, and currently we have AI and LLM-based chatbot work that we are applying for a grant for it. But as basic one, we are going to soon set that up, where you can ask a query like, how am I doing? And the chatbot will bring information about, you had all these symptoms, some things are not going very well, and others you are improving. That, simple chatbot that can provide that kind of answers. So that's the references. Any questions? And yeah, I had the extra time, so if anybody wants to go back and see the platform again, I can show that to you.
Great. Thank you so much for that really interesting presentation. Wow, what an impressive app it is. We
Thank
have
you.
several, you're welcome. Thank you. We have several really good questions in the chat, so I'm going to start with those as well as I have a couple of my own. So first question was, someone asked, did you look at the Visible app for long COVID and something called a CFS/ME?
No, for long COVID.
Yes, that's what it says for long COVID.
Yeah, this the system I have a long COVID tracker added to it. Let's see, where is it?
Yeah, and that same person also said that the NIH Recover has documented over 200 symptoms associated with long COVID. And then
Yes.
as you're looking for, they're asking which ones does your app track?
Yeah, here we go. The long
Yeah,
tracker.
I see
Yeah,
it.
this is the tracker, and we track, it's like a checkbox and extra ones, and these are the ones that are suggested online. So we have those. And, any new apps that are coming up, I will take a look and see, make sure that, this is comprehensive enough.
Nice, thank you. That said, I wondered if this data, you said there will be a lot of data for studies. And so that said, is that data available to others for studies? So for example, this person interested in long COVID?
The data, it depends on, what kind of study we are doing. And so each study we recruit people, collect the data, before recruiting, we have to go through IRB approval, collect the data, and then that data will be made available based on, who is doing the research. So if somebody else wants to use the platform and apply, then we have to go through all the process, and then that data can be made available.
Okay, thank you. Another question is, they first say that this is a fantastic tool, and then they wanted to know whether the LOINC coded promise surveys are a part of this, and would they be useful as part of the tracker if they're not already in there, the promise surveys?
Yes, I am a big fan of promise surveys, and for all these trackers, what I did was I looked at all kinds of different scales that are available, and promise scales are one of them. And then I looked at what kind of information would clinicians need, and then I looked at what are the care guidelines, and based on all that, I developed each of these trackers. So the promise scales and the questions are part of many of the scales, and it's sometimes it is like, the promise scale has, 4 different questions, but then, mine is, that will all be included in one, drop down menu. And so that is how I developed all these trackers.
Nice. Another person says, this is an excellent presentation, a superb tool. And if we wished in the future to make it available in other languages, would that be possible? What would be needed to do that? And then a follow-up to that is, did you assess literacy levels of the participants?
Yes, I am interested in, offering it in different languages, and that's the first step I'm taking to, do this in India. Although in India, there are English-speaking older adults, several of them. So, but it's still the language, medical language used, and other things would be slightly different. So that is going to be my first step. My other interest is in developing this in Spanish. So yes, those are in the works. What was
the second question was about the literacy levels of participants. Was it assessed and geared for that?
The literacy levels, as long as they can read English at an 8th grade level, it should be fine. My first, the people who have checked this out and was able to read are all seniors, older adult Black African American women. So I went to the senior centers nearby, which includes a lot of low-income African American women, and so the literacy level, like, I know it should be like 8th grade, but health literacy level, I don't know. We haven't measured that. So for low literacy people, this is not going to be that difficult to use.
Thank you. So one of the participants has noted that the screen is really packed with a lot of information. And I was thinking the same thing, that a user could get lost within the website. So is there any mechanism or thoughts about tailoring this to maybe like an upfront assessment of what diseases they're dealing with that then would, bring the tailored screen to them for the symptoms that are most applicable to them?
Yes.
Or is that not? Okay, go ahead.
Yes, it is actually set up. You are seeing a lot of symptoms because I have checked all the health conditions here. So if you pick only 1 or 2, you won't see that much. There will be only few of them that you will see. So, it is very highly unlikely that, someone will have all of these. But I did have someone who has, 10 different types of pain. But, even if they have all the pain, they'll see the, pain trackers and then the general trackers and not many of these. So it is, we have tested it with a smartphone, and it is not too crowded. And the pictures are just placeholder things there, like AI chatbot or something at that place. So it's not, if you have a few chronic conditions, it won't be that crowded.
Okay, that makes sense. That's nice. Several of the questions have to do with the use rate, the retention rate of a user. So if they are given the app, how much do they use it? Do they use it every day, once a week? How long does that use last, or, the retention?
Yeah, most of our studies, we actually make them use to 4 weeks daily. So in my pilot study, most of the people did not leave after the study was over, and they used it daily. And there were a couple of people who actually used it for over a year, and they left because of other reasons, not because they didn't want to use it. And it's like any kind of tracker. You get engaged with it and you start seeing your chart and you start wondering what you should do next. And it becomes, just like Fitbit and other things, people continue using it. So yeah, retention or making people use it for more than 4 weeks have not been a problem at all. They use it daily. And other thing is that for each tracker, it is, you can actually go back day and fill out if they forgot something. And we have other things like new symptom tracker that you can customize and add a new symptom that they want to track. And there is also quick notes. If you don't have time, you can just fill it and it will capture the time and date and the symptom you entered, and you go back and enter in the tracker. So there are so many other things that will allow them to keep using it daily. And once they get the first few days hang of it, then using it daily has not been a problem for many of the study participants.
Great, thank you. And how do you promote its use among people? Are they only in studies, or is this out and available publicly for anyone to use?
It is out there and public and for people to use, but I don't do much marketing on it. My interest is in using this for research, but I have had requests come in every now and then. And like as my interest is, I would say, maybe we'll have a study soon, or there is another study. If you're eligible, you can participate. But there have been, community members and other organizations who are interested in collaborating and getting their patients to use it. And that is ongoing. but it is free and available for anyone to use it if they have chronic conditions. I do collect in a separate form their details so that, I can protect it from, people who are not using it for that purpose. And so it is available. But if you want to participate in a study, then I have to go through IRB approval and stuff before I
Yes.
recruit people. Yes.
Okay. And what proportion of caregivers access the app? You said there is a caregiver portion to it where they can give permission. Do you have a large contingency of caregivers?
And no, we are currently doing a study with MCC and caregivers. So we are recruiting people currently for that study. So I haven't marketed it with caregivers. And usually the idea was to get older adults to use it and allow them to provide access to the caregivers, not the other way around. But now I have some people who, the older adult with the dementia don't want to use it or can't use it. So the caregiver is creating an account for the older adult and then providing access to themselves and then accessing it. So the idea was not for caregivers to start using it, but older adult to start using it. And the other reason is that I want to provide older adults the control to which caregiver they want to provide access to.
Exactly. Thank you. Well, and then as though you didn't have enough work to do, there's a couple of suggestions or questions about interoperability and hooking this app to the EHR, like Epic, so the PCPs or longitudinal care managers could track the symptoms. Any thoughts about that, about making it interoperable with EHRs?
That is a question that I get from reviewers when I apply for grants. The one thing with this, with the issue is that electronic medical records already have a lot of information, for the physician. Adding this will actually increase the burden for physicians. Do they want that? And there is also liability issues. So if someone, records chest pain, should they be, reading all the information? I have disclaimers everywhere that nobody is reading their, any kind of input. So that is down here, and that we don't sell any product or service, and we are not actively looking at their data when they enter it. So connecting it to EMR, is more burden for physicians. They are already burdened with a lot of information that they need to. And this is going to increase their burden, and also there is liability issues. Another thing that we have right now is, in Wisconsin, we have something called Impact Connect, or it's also called 211, Impact 211, which is connecting older adults with the local resources. So I am part of that. And if, there are people who are managing multiple chronic conditions and they need self-help management support, physicians, the EMR is connected to the Impact 211 platform, and they can actually prescribe to go and get support from community for those multiple chronic conditions, and that will connect us to them. So it's there is an intermediary, and that way they can be connected to us, but not data inputting directly to EMR. No, I don't foresee. I don't even know whether I want that, but but there are ways that we can provide a summary of information to the provider by some other route in future studies. Yes.
Thank you. Thank you. Another question is, someone is curious to know how the platform visualizes tracked symptoms. Can you show us some of the functions? There was a section perhaps called Play with My Data.
Yes.
Is that what that is?
Yes. It is, there are a lot of things working behind. I coded it all myself. And yes, we have MySQL and the data goes in there, and we provide, use PHP to get the data from MySQL and show it in table form or chart form.
Thank you. And have you thought about gamifying the app user experience?
We have currently got some games. This is like memory games and stuff like that, but not actually gamification. But the fact is, just tracking your health conditions, that's the beauty of Fitbit and Apple Watch, and why people use it a lot is that, keeping track of things actually is kind of like a game, where you track and get to know these things. You see your chart and then analyze it and figure out things. So that's, something, that occupies your time, and it's kind of a fun activity. But no, not exactly, I haven't looked into, gamification. I would be interested in knowing how to.
Thank you. Someone said, in bringing this awesome tool to South Asia, are you already thinking about how you might need to tweak it for another culture or healthcare ecosystem? Could you talk about that if you have?
Yes. With India, that's one culture I'm familiar with. So I am going to see how, it can be culturally adapted. And then, I can probably adapt it for other languages and other cultures. But, that requires, people with expertise and in that culture. And we have to collaborate and maybe apply for a grant and then, do that. So yeah, I get people with expertise in different areas to collaborate so that we can improve this further.
Okay, thank you. And can you talk about your evaluation of the feasibility and usability? What kinds of things did you look at and what did you learn?
Feasibility, like I said, most older adults are able to use it, and they do use it for a prescribed number of days without any problem. Usability issues, I developed this like 3-4 years back. Each time, there is technology changes, we can improve it further or we can adapt to it. Making it more into an app format, whether that would be useful. The bigger screen with the laptop, we sometimes for our studies, we do provide Chromebooks and other things so that, older adults don't have to, use the smartphone. So bigger screen seems to be a better idea for older adults, but even, when I don't have the money to provide Chromebooks, they seem to be fine using smartphones to use those. During the pilot study, whenever there was, usability issues, I had a lot of things, it was kind of differently designed. And it was all a drop-down thing from the main menu up there, and that was kind of difficult for people. So I changed those. So after each study, when people complain about things, then I keep changing it. So it is very adapted to older adults and how they see things and how they like to use it. And I did, even during the prototype building, I let people, gave them my laptop and mouse to see if they can use it. Even with people who have hand dexterity issues were able to use it.
Okay, that's good to hear. Thank you. So the remainder of the comments in the question and answer section are really advice or, connections for you about this body work. So we'll be sure to share the chat content with you. And those are all the questions we had today. So I want to thank you very much for this really interesting session and congratulate you on this really important work. It's looks like a very useful product. For those listening, the recording will be shared on YouTube next week, and we will return on Thursday, December the 12th at noon for our next webinar. The speaker on that day will be Julia Adler-Milstein, and she's a professor of medicine and chief of the Division of Clinical Informatics and Digital Transformation at the University of California, San Francisco. And she'll be talking about assessing the use and impact of telemedicine in the primary care setting for people with dementia. So again, thank you so much, Dr. Nambisan. Really appreciate your time, and your work is really impressive, and wish you well.
Thank you very much.